This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey beautiful soul, it's Jacqueline from the Lost Labia Chronicles in partnership with Lichen Sclerosus Support Network. If you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to our channel and keep on watching. And if you have a friend or family member with lichen sclerosus and you want to learn more about the physical and mental health aspects of living with LS so that you can better support them in their journey, then please share this channel with them and keep on watching. All right, so in today's video, we are going to move into sexual health. So this is going to be part of an ongoing series where we look at sexual health issues in relation to lichen sclerosus. So today is going to be more of a general overview video where I'm going to go over all of the associated sexual health related symptoms that may occur if you have lichen sclerosus. In future videos, I'm going to be addressing each one of these symptoms individually, and we're going to go through kind of what you can do if you experience them. So for example, if you have clitoral fusing, we're going to talk about what you can do about that. If you have hypertonic pelvic floor, we're going to talk about what you can do with that. So definitely subscribe to our channel, hit that notification bell so that you don't miss when those future videos come out, because there's going to be a lot of really good practical advice and tips and tricks on how to manage each of these individual symptoms. And if you are struggling with sexual health and you are really in need of some good support, consider joining Lichen Sclerosus Support Network's free virtual lichen sclerosus meetups. These meetups are held every other Saturday from 2 to 4 and 7 to 9 p.m. Eastern Time, and they are co-hosted by Kathy, who also makes videos on this channel, and myself. If you do want to join us, you can go to lssupport.net/connect. Again, I will have that link and any other links that I refer to in this video will be in the description box below if you are watching this directly on YouTube, or just kind of on the page if you are on our website page. All right, with that, let's dive into things. So, dyspareunia is the medical term for pain with sex. We're just going to keep it simple and call it pain with sex, okay? I'll introduce the fancy term and then it will just kind of sit there, just so that you know if ever your doctor mentions it and you're like, what? At least this way, you know exactly what they are talking about. So again, pain with sex can happen if you have lichen sclerosus. And the pain that you experience really tends to vary on an individual basis. So you may experience rawness or stabbing or stinging or burning during sex, or even after you've had sex. If you've watched my diagnosis story, and if you haven't, I will leave it a card up here, and I will also leave it linked in the description box below. But if you've listened to my diagnosis story or you've worked with me in any capacity, you probably know that pain with sex was one of my earliest symptoms, and it was something that I started to feel in my early 20s. And so it kind of started where I would just feel discomfort, I guess, is the way that I describe it, because I kind of don't know how else to describe it. But during penetration, there would be discomfort. And then gradually over time, that discomfort kind of moved into, official pain category. And initially it was only during sex. So like once penetration was done, after like 30 minutes, the pain would kind of subside. But as the years went by, that pain would last well after. So if I would have sex, during sex, it would burn and it would feel like stinging and searing. And then even after, it would burn and sting when I would urinate. It would, be painful for, 2, 3, even weeks afterwards. And so that obviously just kept occurring. Another thing that occurred for me, and we'll talk about this a little bit, is tearing. So I didn't start tearing right away. I think I started tearing probably when I was like I want to say 25, but I wasn't documenting things, so that's kind of an estimate. And for me, I would tear during penetration. And the main areas, and of course, we've got our trusty vulva puppet from the Body Agency. So really quick recap, this dark purple, your labia majora, this crimson, I guess, color is your labia minora, the inner lips, majora outer. You've got the clitoral hood here in this, I don't know, I guess navy color. And then this little pink circle thing here is your clitoris. So or the clitoral glands, I should say. Of course, we have kind of the vaginal opening here and then the perineum here. Now for me, what I would experience was a lot of tearing at the vaginal opening. So not inside the vagina, but like right at the entrance, as well as the perineum. Those areas tended to tear a lot for me, to a point where it almost seemed like it was a guarantee anytime there was penetration that, I was going to experience tearing. So if you do experience, pain with sex, any of these things, there's no, kind of right or wrong way to feel pain with LS. It presents differently on everyone, and the severity will also depend, right? Some folks will say, it's painful, but it's not too bad. And then others will say it's painful and it's excruciating, and I absolutely cannot have painful penetration. So let's talk about how common is it to experience pain with vulvar lichen sclerosus? Well, turns out that a study in 1995 shows that it's quite common. So this study had 45 patients with vulvar lichen sclerosus and had them fill out a questionnaire. And that questionnaire revealed that 75.5% of those 45 individuals with vulvar lichen sclerosus experienced pain with sex. So that's about 3/4. That's a nice majority of people. So 2 points on this. One, having vulvar lichen sclerosus does not guarantee that you will experience sexual, health issues or that you will have pain with sex. Some people don't, some people never do. Another thing is that if you catch LS early, you may be able to really keep the LS in check so that it doesn't progress and then you don't get these symptoms. Again, one of the many reasons why, early detection is just so darn critical. And then the other point is that if you do experience pain with sex in any capacity and you have lichen sclerosus, you are definitely not alone. The numbers show that, right? Basically, 75.5, 3/4 of people with vulvar lichen sclerosus experience this in some capacity, whether it's mild or severe. So don't feel alone. There are numbers of us across the globe that are experiencing this, suffering from this, and living with this along with you. And a final point that I want to mention with respect to pain with sex as a symptom of lichen sclerosus is related to quality of life. So, an important question to always ask is, how does your condition, how do these symptoms impact your quality of life? And this is something that all healthcare providers should be asking, and something that all healthcare providers should really, really care about, which is, how does this condition impact the quality of life of their patients? And we do have studies on this. So there was a study that kind of had patients rate different aspects of their lichen sclerosus and see, how it impacted their quality of life. And of all those different evaluations, pain with sex impacted people's quality of life the most. So more than itching, more than architectural changes, it was painful sex that really had the deepest, most profound impact on quality of life. And I can say from personal experience that that is absolutely true for me. I had almost all the symptoms of lichen sclerosus, and by the time that I was diagnosed, it was pretty advanced and my symptoms were very severe. But of everything that I experienced, by far and large, what had the biggest impact on my mental health and my quality of life was my sex life, or at that point, my lack thereof. And it makes sense, right? I mean, human beings are social creatures. Our relationships, our romantic and sexual relationships are really, really important to us, whether you're in a relationship or not, right? If you're in a relationship, you might start experiencing, cracks and fissures in your relationship. You might start experiencing difficulties that might kind of threaten or really make you question your identity as a sexual being, your identity as a feminized person, if that is how you identify, the relationship between how your vulva looks and your self-confidence. It really impacts all of that on such a profound level. And then of course, if you are not currently dating someone or multiple people, or have relationships with people, then you're very, very worried about how do you start dating, right? Like what do you tell people? What do you tell prospective, individuals that might become a sexual or romantic partner? How do you explain this? A lot of people tell me, I don't even see the point in trying. I deleted all of my, dating apps. I basically took myself off the market because who's going to want me? And if that is you, I am sending you a massive, huge virtual hug, because when I was diagnosed with lichen sclerosus, I was already married, and I can't imagine being in a position where, I wasn't, and I wanted, a partner or partners, and trying to navigate all the complexities of, disclosing what I have and working through that and helping that individual or those individuals learn my body in, a different sense, in a sense that they're probably not familiar with. There's a lot of intricacies and difficulties and anxieties that are kind of wrapped up in this. So really, really, really profound impact on our mental health and our quality of life. So again, if this is you in any capacity, you are not alone. Consider joining our virtual meetups. I also offer one-on-one individualized LS peer support calls. I offer them in 30 or 60-minute Zoom calls. You can learn more about those calls by going to lostlabia.com/support call, or you can email me at jacqueline@lostlabia.com for more details if you're looking for more guidance, more support, and we will definitely have videos on these topics in the future. So as always, make sure that you are subscribed to this channel and notification bell, and or sign up for our newsletters so that you get notified about when these videos drop. All right, so another sexual health symptom that may occur if you have lichen sclerosus is loss of clitoral sensation. So let's talk about that a little bit. So this is primarily due to something that is called clitoral phimosis in the medical community. Now, phimosis is just, the medical term for fusing or scarring, stuff like that. So again, we'll just leave the term phimosis at the door. I'm going to say scarring or fusing, but you know what the medical term is. So the inflammation caused by lichen sclerosus causes a lot of changes to the skin, to the vulvar skin. This causes a number of changes, but it can create scarring and fusing. Now, again, bust out our little vulva puppet. So with respect to the clitoris, what can happen is here we have two separate parts, right? So we have this blue part, that's the clitoral hood or the clitoral prepuce, and then this little pink thing here is the clitoral glands. Now, in healthy vulvar skin, folks can kind of retract this hood or this prepuce to kind of reveal that clitoral glands. So that hood will kind of slide easily over the glands, so there's good mobility, and you can visualize at least, some part of the glands. Now, again, what happens with people with lichen sclerosus, or what can happen, is that inflammation can cause a lot of scarring. And what can happen is that this hood here can actually start to stick to and adhere to that clitoral glands. And that can cause partial or even complete scarring, so that clitoral gland is buried under this clitoral prepuce. So essentially there's a lot of scar tissue here. Now that scar tissue basically can cause in some folks loss of sensation or reduced sensation. So our clitorises are very, very sensitive, but when it becomes buried, sometimes we can lose that sensation. So think about touching an object with a thick pair of gloves, and you pick that object up in your hand. Now, of course, you will feel that object is in your hand, but you may not feel it as intensely as if you were holding it with your bare hand. Now, something similar is happening with the clitoral fusing, where that scarring, that scar tissue that forms between the hood and the glands, that basically represents that thick glove, right? So it's just really kind of covering over all of those really, really sensitive nerve endings that are present in the clitoris, making it harder for us to kind of fully feel any kind of stimulation. This is definitely something that I experienced. By the time that I was, diagnosed, I had basically fully covered over. I've had so many doctors look and examine me and go, oh my gosh, I can't see an opening. I don't think you have one. I think it's completely scarred over, which of course is a very scary thing to hear, very distressing thing to hear. But of course I share this because I want you to know that you're not alone in that. And I did have that scarring, and I didn't experience total loss of sensation. So I'm very grateful for that. Even though it was completely covered, I never fully lost sensation, but there was definitely a reduction, right? So it just wasn't as sensitive as it used to be once upon a time, but I still had some sensation. So you can actually have full scarring and still have sensation. And some people have this fusing and don't report any loss of sensation, right? So it's another thing that's very individualized. But again, something that's very important to know that this can happen. And again, there will be videos on what to do if this happens to you. There will be blogs on this. So definitely, keep an eye open for those pieces of content. And, finally, just to kind of wrap this little portion on clitoral fusing up, is that not only can this, just be distressing to lose that level of sensation, the other thing is that this can really start to impact your libido and, cause a kind of decline in your libido. And honestly, it makes sense, right? Because if you're not really feeling much and you're not feeling pleasure, then why would you want to have sex, right? Other than the, kind of, I want to please my partner thing, which I've definitely heard a lot, or please my partners. It makes sense that, your libido would kind of take a little bit of a hit because you're not really experiencing much pleasure from this. And then if you also happen to have pain with sex, then it really makes sense that libido would dip because it's painful and it's not fun. So of course your body is not gonna kind of be seeking it out or wanting it, right? But we are gonna talk about libido shortly, but just wanted to make that point. Okay, so remember how I just said the inflammation that's caused by LS causes the skin to go through a number of changes which can lead to various symptoms? Well, another change that can occur from that inflammation is thickening of the skin. And I do have a whole video that addresses the question, does lichen sclerosus thin or thicken the skin? Again, I will have a card up here and I will link that in the description box below if you want to check that out. But short answer is lichen sclerosus actually thickens the skin, even though with your eye, the skin may appear thin on the surface, there's actually a lot of thickening. So lichenification actually means thickening and hardening, right? So something that is rigid and thick and doesn't really have a lot of give or elasticity. So because of that hardening or that thickening, Some folks will experience tearing, specifically tearing during sex, but you can tear even when you're not having sex. I used to, say that, oh, I tore because the wind blew. I mean, it just seemed so easy for me to tear at one point. I would like walk to the bathroom or walk up a flight of stairs and I would get a tear or a fissure somewhere. So very, very frustrating. But we're going to talk about this in the context of sexual health. So to demonstrate, I have a couple of elastics. Now I do have a longer video that does address this question. So again, description box below, but we've got 2 elastics here to demonstrate this thickening and what happens. So the first elastic, this purple elastic, is thinner and it has a lot of mobility and elasticity. So this purple band right here, we are going to say that this band represents healthy vulvar tissue. So tissue that is not thickened or lichenified, right? So again, very easy to stretch and accommodate and all of that. Okay, now we have a blue band here. I think this is from I'm pretty sure this is from my broccoli. Okay, so this band is much thicker. And as you can see, I'm having a really difficult time stretching it. I'm actually shaking as my muscles are engaged trying to, stretch it out. So think about when you are having something inserted, since something is penetrating you, you want the vulva, the vagina to stretch and open to accommodate that, right? So we want this. We want it to be like, oh, we're putting something in. Here you go. I've made room for you. Instead, we've got something like this. Really hard, really hard. No matter how much you want it to go in, it's really difficult. And what can happen is because this is so rigid and so thick, that thickened skin is prone to cracking and tearing and fissuring because it lacks the mobility and it lacks the elasticity that the skin needs to stretch and accommodate for anything being inserted. So, as I mentioned before, a really common area for folks to tear is at the entrance of the vagina. So again, not inside, but kind of right at the entrance, as well as the base of the perineum, which is kind of right below that vaginal opening space. Now, some people will also experience tearing on their labia minora with sexual activity, and some people will also experience it around the clitoral area. I don't really recall it happening to my labia minora. For me, it was kind of like 12 o'clock and 6 o'clock, so the clitoral area and the perineum area. But the perineum / kind of vaginal opening seems to be by far and large the biggest kind of trouble area with respect to tearing and penetrative sex. So those tears can be really, really small, or they can be quite large. Again, it varies per person, and the pain also varies per person, but it definitely hurts, right? You would imagine that tearing yourself down there is not a pleasant sensation. It's definitely one that will cause pain, that will be distressing. That pain can vary. Sometimes there is blood with those tears. So sometimes there's blood, sometimes there isn't. Usually when you tear the first few times, there will be blood, and you may notice that right after sex. Your partner might say, oh, I'm seeing a little blood. Are you menstruating? Or like myself, when you go to the bathroom after and use toilet paper, you'll see after you kind of wipe or dab, I never wipe, but just kind of dab it, I would see blood on my toilet paper. And then I would be like, oh, darn it, I tore again. But you don't need to bleed to have a tear. So especially if you tear in the same area, after a certain amount of time, there might be less blood or even no blood. So don't think that for it to be a tear, there has to be blood, but there can be. And then of course, now you have this open wound. So things like urinating will be incredibly painful, right? I always say, think of a paper cut because it's easy. Everybody's had a paper cut in their life, right? So think of a paper cut and then think about rubbing alcohol on that or squeezing lemon juice. And that like stinging, burning sensation that you get when you do that, it's the same thing when urine gets into or on that tear, that open wound. So that can cause more discomfort, more stinging, more pain, more burning. So tearing from sex is another symptom that can happen with lichen sclerosus. Another thing that can happen if you have lichen sclerosus is you can develop a secondary condition, which is called hypertonic pelvic floor or overactive pelvic floor. We're always kind of changing and revising the names, so I'm pretty sure if you're watching this video in like a year from now, it will have a different name. But those are kind of the two main ones that are floating around right now. And an overactive pelvic floor essentially means that your pelvic floor muscles are chronically engaged, chronically tightened, and are unable to relax. And so this can happen to a lot of folks with lichen sclerosus because there's a lot of trauma and pain in our histories, in our past. And because of that chronic pain, like pain from sex or generalized pain, because of, a lot of medical trauma that people have with lichen sclerosus, even just the difficulty of waiting, 5 to 15 years to get a diagnosis, right? That's a really long time to be in so much pain and so much distress. And so your body, in an attempt to kind of protect you from that pain, to keep you safe, right? It means well. What it does is it just kind of tightens everything up. And in tightening everything up, it kind of makes insertion difficult to sometimes impossible for folks. So imagine, right? This is super, super tight, super, super tight, trying to get something inside. It's going to be incredibly painful because for it to not be painful, we need those muscles to calm down so that we can kind of insert something in. But when they're tensed up and they're rigid and they're tight, it makes it hard and it makes it really, really painful when you try to insert something. And inserting something doesn't have to be a penis, by the way. It can be a toy, it can be a tampon, it can be a speculum, it can be anything like that. And it'll cause pain because those muscles just can't relax. So, and then, of course, if you also have a lot of lichenification, a lot of that hardening, remember then again that the skin also doesn't have a lot of give and is really tight and rigid. And then on top of that, if those pelvic floor muscles are really, really tight, it's just, there's going to be a lot of pain. There's going to be a lot of difficulties with sexual activity. So this is something that, tends to be really common for folks with lichen sclerosus. And this is why I always tell people, if it's accessible to you and you have an LS diagnosis, please try and find a pelvic floor physical therapist, get assessed, and work with them. Worst case, they give you an assessment and they say, hey, your pelvic floor is amazing. It's so chilled out. It's so relaxed. There's no trigger points. Super duper healthy. I see nothing wrong. You don't need to work with me. Great. Okay. Now you know, and now you have a pelvic floor physical therapist on your team. If ever you need to use them in the future, you have somebody there. And if they do see anything in the assessment, like an overactive pelvic floor or a lot of trigger points, etc., they can work with you and teach you tips and tricks to start slowly learning how to relax those muscles. And relaxing those muscles creates more space, more flexibility, and that's what we need in order for, sexual activity and sexual penetration, especially, to not be painful. So again, pelvic floor physical therapists are tremendous resources on this one. So last but not least, we have libido, or more specifically, lower libido. And that is something that, again, can occur if you have lichen sclerosus. So libido, if you're not familiar with that term, that really just relates to your sex drive and your desire for sexual activity. So some folks will say, I used to have more desire for sex. My sex drive used to be higher. And then, when I got lichen sclerosus, it seemed to decrease or even flatline completely. Some people will tell me, yeah, I just don't have any libido anymore. I have 0% interest in sex. And that's definitely not uncommon. This is something that's documented in a number of studies that look at, the relation between libido and sexual health in individuals with lichen sclerosus. And overwhelmingly, what these studies show is that people with vulvar lichen sclerosus are having considerably less sex or sexual activity compared to control groups. Control groups are just a group that you're comparing, this other group against, and those control groups do not have vulvar lichen sclerosus or any sexual health disorders. So compared to that group, right, the people with vulvar lichen sclerosus had considerably less drive. And even more than that, what studies are showing is that they have less drive, they have less arousal, there's less lubrication, less orgasms, and less satisfaction. Again, all of this makes sense, right? If we look at the other symptoms, loss of sensation, pain with sex, tearing, overactive pelvic floor muscles, it makes sense, because why would we have a drive for something? Why would we want to seek something out that causes us pain and or doesn't cause us any pleasure? It's not fun, it's not pleasurable. Why would we want it? It makes a lot of sense. And then if you couple this with kind of body dysmorphic issues, so I've spoken very candidly on my YouTube channel about my experience with this, where, for the longest time, I just hated the look of my vulva. I thought I was gross. I was embarrassed by how I looked. I thought it was ugly. And that really affected my self-esteem and my self-confidence. And, that does play a role in libido, right? Because libido is impacted not just by biological things, but by psychosocial things as well. And so, my lack of confidence, my feeling gross and ashamed and embarrassed and ugly, that is a psychosocial factor that really just compounded that libido issue that I was experiencing. So again, really, really normal if you think about it. So if you're experiencing low libido issues, you are definitely not alone. Whenever this topic comes up in a virtual meetup and we do like a little poll, or raise your hands or A for this, B for that, overwhelmingly everybody says that their libido was impacted in some way, shape, or form, right? Not everybody loses it, but almost everybody reports a decline compared to what it was like before they started experiencing symptoms, before they had LS. So again, this can be quite common, and I definitely have plans in future videos to dive more deeply into this topic of libido. And it's not just going to be one video. We're going to have multiple videos, going to bring in some experts to talk to us about these issues and how they kind of intersect with lichen sclerosus, because honestly, libido is a really, really, really huge topic. It is incredibly complex. So it requires a lot. I have book recommendations. I have so much. This is something that I'm really passionate about and something that I'm really starting to, explore more heavily. Both libido in general and libido in the context of lichen sclerosus, and then libido in the context of any kind of vulvovaginal disorder that people might have. So definitely keep your eye out for those. Those will be coming up in the future. So hopefully those will be helpful and beneficial for you. And again, we can always discuss these in the virtual meetups or on a one-on-one call if you want more time to really explore and chat about these issues. All right, so to wrap up this video, we have reviewed a number of sexual health symptoms and issues that can arise if you have lichen sclerosus. Importantly, please note that having LS does not guarantee that you're going to have every single one of these symptoms. In fact, there are some people that never have any sexual health issues with lichen sclerosus. I've personally spoken to some folks that have never had a sexual health component, be a part of their LS journey. So I always want folks to know that just because all of these things, are things for some people doesn't mean it has to be for you. And as always, early detection is so important because we can really prevent a lot of these things from occurring if the condition is caught early. This is why I am so passionate about the work that LSSN does to, create change and create a better future for folks with lichen sclerosus and really cut that diagnosis time down from 5 to 15 years. We want to see that way down. We want folks getting diagnosed way earlier so that hopefully in the future folks don't need to, get to this point where they're experiencing these things. But if you are experiencing any of these, and FYI, I experienced every single one of these, there will be videos in the future. I'm going to go through each individual symptom, go in that in depth, and then go through, different options that you can have to manage or improve those, as well as, tips and tricks from my personal experience and my journey with this. So definitely stay tuned for those. Let me know in the comment section below if you have any of these symptoms, what your symptoms are, anything like that. If you don't have sexual health component, anything like that you want to share. If you have any questions about anything that I said in this video, I always love hearing from you. So drop that in the comment section below. And that is it for this video. I will catch you in the next one.